Because can you imagine if you get a cut and there was no mechanisms put in place to stop the blood from gushing out? We would all die because it would be almost impossible for us to avoid traumas that can lead to cuts or wounds. Alright? Now, there are several stages in wound healing. First, whenever there's a cut, what's the first thing that we normally see when there's a cut? There's bleeding, right? Right. So whenever there's a bleeding now, the first thing that tends to happen is a process where the blood or the body sends out chemicals to these areas where you have a breach. Because once there's a breach, it's going to rip open the blood vessels as well. And once there's bleeding, there are mechanisms that are in place to detect that there's loss of fluid, especially in the form of blood. And so what happens is that the body sends out the chemicals to constrict or make those vessels narrow. So when you make it narrow, what do? You cut down the blood flow, right? This is what we call homeostasis, meaning to return to normal, right? So it's trying to stop the bleeding and return to its normal phase. So you first constrict those vessels that are broken, and then now it sends out what we call clotting factors to these areas, especially where you have what we call fibrin, which acts like the mesh. You notice those mesh outside, but they use as fencing. It actually looks like it. So it forms these gaps like a sieve. And then we have another structure called platelets that looks like plates. They literally look like plates. So you can imagine you have the fence out there and you plug it up with a lot of plates. You actually block or seal out the wound. Right? So that's the first stage where you have homeostasis. Now, the wound or the bleeding has stopped. We need to start healing. And one way to heal it now is for the body to move over into a different gear where the body sends out other chemicals now. That the others, that the structures of the blood vessels, those that were broken and those that were not broken, those blood vessels tend to swell. They get bigger. And not only do they get bigger, they actually, the surfaces of the membrane start opening up. And why is it that it opens up? So that the molecules inside these blood vessels that are responsible now can go across, can move over from the blood vessels and go to the side where the injury was. Because what tends to happen whenever there's a cut? Sometimes you may introduce germs, right? Right. And so the body sends out an inflammatory response so that the blood vessels get bigger, so you have more blood reaching in, and then you're going to have more of the body's defense mechanism, the cells that are responsible for fighting germs, to move across the blood into the space where the cut is and arrest it. Right? So that is what happens, and that is why you will find that area tend to be a bit raised when you get the cut, and it tends to be red because more blood is circulating that area. And because more blood is circulating here, it carries a good amount of heat. So you're going to feel the area warm, swollen, and because there is more swelling now, it's going to start pressing on those nerves, so you're going to have the area becoming more tender. Alright? After that is done now, it arrests the germs. Right? So the bleeding stops, just arrest the germs. Now the other phase now is where it starts to heal. You want to repair. It's just like if you don't know, you're going to redo this church. Alright? You have to clear down everything and start from first. You can't say you want to keep down the back. Alright? You have to keep down a portion of the wall and put in reinforcements. And that's what is happening. Reinforcements of those areas that were broken starts filling in the gaps. Alright? And as time goes by, right? reconstructing the normal tissues that were there. And that is why, for some persons, especially how deep the foot is, it can take up to a year or sometimes 2 years before they feel that stiffness actually goes up. Any of us have gone through surgery, you have to get deep cuts. Yes. Right? And sometimes you feel that tightness. Yes. And sometimes you even feel the tightness even years after, especially when it starts getting, when it starts raining, or the time it's cold, you feel it tightening up. Right? So these are some mechanisms that actually takes place during the healing process. Alright. Now, the sad thing about it is that sometimes the wound becomes infected. Alright? Now, the wound becomes infected whenever it depends on a number of reasons why the wound can become infected. It can be as a result of a lot of germs entering the wound, and the germs are so much that the body cannot put up enough fighting mechanisms to destroy it. Right? So the wound actually becomes infected whenever it becomes more than what the body can bear. Alright? So we can move over some more. Now, this is an example of a wound, and the wound itself does it look like a clean wound? Or it looks like a wound that has some infection in it? Yes, it has some infection in it. Why is it that you think, or why is it that you say that there is some form of infection in it?
Because I
Alright, can you just raise your hand? Yes?
Because of the little eye part.
Yes, there's a puncture there. Alright? Alright, there's a reason why there's a puncture. Anything that you can do to see that something is not right with this here? Alright, that is right at the rim. There seems to be a little discoloration right at the edge.
It's a bit red and inflamed.
Thank you very much. It is red. And when you say it is inflamed, you mean that it is swollen. Right? So all of these are signs that the wound is not a clean wound anymore. Something is going on. It becomes infected. Now this is a wound that actually was ruptured because prior to this there was an accumulation of pus. And the pus is really an accumulation of the debris that was formed as a result of the dead cells that were fought in the body. So there's a combination of the dead bacteria, the dead fighting cells that are there to fight out diseases, and also the dead cells of the body. So it's a combination of all of these factors along with fluid coming from the blood itself. Alright? Next slide. Alright. Now, before we go home, can I go back home? Alright. So, this is what we want us to understand. Because every now and then we're going to have wounds. And we want to know if the wound becomes infected. Now, we have mentioned some signs of an infection. Can we name them again? It's red. Swelling. It has some, yes, you can see a yellow, right. Sometimes, not all the time, but you can see a yellow discoloration between the skin and the hairs.
The eye that looks active. The eye looks good.
Sometimes they call it a crater. Sometimes a crater may form right at the tip, just like a volcano. Alright? So it says red, it is swollen. And what about the ear? When you touch it, what does it feel? Very tender. Right? What again? It drains. Thank you very much. It tends to drain. These are telltale signs that there's infection. And the other thing too, when pus, that's what it means. The draining is the pus. Other thing too is that when you touch it sometimes, right? Especially when you have an abscess, it may be firm. It can be firm. And sometimes, so the firmness is when it's what we call it's not yet right. Right? But when it becomes right, it moves from being firm to a bit soft. touch it, it will just close. Right? So those are the signs. Now, those are what we call localized signs because it's local, it's within the same area where the wound is. What happens if it is that it moves from the wound and goes somewhere else? What other signs do you think may happen? Or what do patients or what do persons depend on other than the area that is affected? What other signs do you think can cause? Fever. That is the first thing. Fever. And there are other signs or complaints that the person may have. What was that? Thank you very much. And indicators, please. No, sir.
You have swelling of the limbs, what we call wax and cannula.
Thank you very much. And it's very important to know this because the area where the wound is, check the nearest crease. So if it is in your leg, check your groin. If it's in your hand, check your arm. So those are the areas that you check for. So in your chest, check your arm. Anywhere there's a nearest crease, just feel up there. And if it's in your head, where do you check? In your ear or on your neck. Alright? Those are the areas that we look for. Thank you very much. That's a very, very, very important point. Thank you. Because what is happening is that information from the infection is going up to the lymph node because this is where the fighter cells, God is very, very, very clear. This kind of body like this. No matter how much, I feel like coming in with a supercomputer. There's no supercomputer that can be like these mechanisms that work by itself. You don't have to go in and program it. It actually knows what to do. Right? So what actually happens is that whenever the wound or whenever it becomes infected, and especially when it seems as though it's more than what the body can bear, there are specialized cells, we call them macrophages or big white cells that go there and plug on to these bacteria. And instead of mounting on war, what they do? They go to the lymph nodes. And the lymph node will be like a police station. And this is quite a report in this case. I carry the bad man in here. See what it looks like. And then no. The other squaddies now, we call them mercenaries. They go on them mission now and say, alright. So we need to bring AKs and big blocks for these guys now. And they go on the machine. And then multiply. And then you have a next set of carrier molecules that bring them to the site. And the same squad that was there says, see them over there, so they go there and kill them off. Right? That is how beautiful the Lord God designed the immune system. Right? Alright, let's just go further. Alright, can I go over? Alright. Right there. Now, we're going to be talking about some factors. Alright. We talk about infection of a wound. But let us say that I have a cut. So not every cut will become infected, don't it? Yes. But what are some of the causes that you feel that can move a simple cut to one that becomes infected? Somebody say something about it? Hygiene. So it depends on the environment. For example, if you get a cut and you drop into a pile of dirt, it's not going to be the same as you getting a cut like right here and not having contact with the nasty part of the environment, don't it? So the hygiene or the environment or the locality of where the wound is. Anything else?
Compromise the immune system.
Stand up for me. No, you need stand up for me. What was that now?
Compromise the immune system.
Compromising of the immune system. Tell us what you mean by compromise of the immune system.
When your immune system is, especially what I would say when someone's immune system is compromised, is like you have a health issue that causes your immune system not to function to its optimal level, I would say.
You know, who say sorry, what's the name?
Sister Kathy.
Sister Candy.
Kathy.
Johnson. Yes. I'll take the sister now. No, that's my sister. So now call it back Johnson. This person is not up. Very good response. It largely depends on how well your body can mount a response to the cold. So if your immune system is weak, you can't fight the infection. Or you cannot fight the germs that are in it. Because as I said, it's not every wound becomes infected. And it's not every wound clean or is healed by itself. Alright? So we learn about the locality or the environment or where the injury is. We also learn about the state of the person's immune system. So the weak immune system will cause that person to develop infection. What are some causes or some examples of persons who have a reduced immune system? Thank you very much. People drink a lot and who smoke a lot. Anybody else?
Certain diseases.
Certain diseases like
Diabetes.
diabetes. That is the main one, especially diabetes. Right? So, your lifestyle contributes to it. If you're a smoker or a drinker, if you're not eating properly, don't you? Right? And if you have certain diseases like diabetes. Right? So, it is very important that those of us who have friends, relatives, whosoever, that we make mention that they have to take proper care of themselves. Just in case there's a wound, it can delay the healing, right? Alright. Give me, is there anything else that we can say that can cause that wound to be infected? Anybody else? Alright. There are a few others, and one of them is the size of it. Right? So if I get a little cut on my hand versus a deep chop wound, right? Or if the wound is big and wide and jagged, right? Those kinds of wounds tend to delay healing. So it depends on the width or the size of the cut, the depth of the cut, and also the characteristic of the cut, meaning that the edges cannot put together the edges. Alright? And there's another cause or risk, and that is the kind of instrument that was used to cause the injury. For example, if I use a surgical knife and give somebody a cut versus a rusty piece of meat, right? You realize that one carries a risk and one carries very little risk. Right? So these are risks. You can just put them on the board for now. So causes and risks. The dirty contaminated objects, we just go to the last thing of the environmental factors. Somebody did mention it. Oh yes, another thing too. Bites are very important. Human bites. You see, somebody bites on the finger, and especially when it goes deep, do not play with it. When I was at the hospital, we had to admit somebody with a bite injury to the finger. Because the human mouth has billions of germs. It's not a mirror. So when you sink your teeth in it, you're going to be sending out all the bacteria, all the germs that is in the teeth, in the gums, in the saliva, onto the open wound. And worse, it touches the bones. You don't play with these. So these definitely need intervention, not just stay at home and watch, but you have to care for a healthcare professional, right? So we learned about these causes, the risk factors, the environment, the type that was used, the bites, the health status of the individual, and the nature of the wound. Thank you. Dog bites as well. Bites are no more, right? Dog bites and human bites, right? not like ours. That's why they can't eat anything and survive. As nothing forms in the mouth and decay in the mouth and causes them to sick. And one of the reasons that they have a very high acid content, much higher than ours. So if you're in your stomach and it itself can stop the bacteria from proliferating. So if you open up a dog's belly or stomach and you put a nail in that, the acid in that stomach can just dissolve. That is how powerful it is. Alright? So those are some of the reasons. Now, complications. Some of the complications now. Alright, so we have an infected wound. An infected wound just does not behave by itself. Right? Some of these infections carry serious consequences, meaning that it can move or progress into something worse. The first one, cellulitis. Cellulitis. Alright, so first of all, so we have mentioned that whenever there is an infection in that wound and it is not contained or it is not treated, the particles that are in that infection can start moving into deeper structures. So it can go deeper, so the infection can spread downwards and it can spread sideways. Right? And so when it stays in that area and moves downwards and moves sideways, it infects the skin. So we have what is called cellulitis. Got a slide, please. Right? This is an infection. This is an example of cellulitis. Right? So when you look at the wound itself, there is an original puncture wound. No, let me go for say something. Not all the time you will see a puncture wound. But whenever you see an area that is red like this and it's spread out further, raised and stand up, you have to consider that there is an infection that is going on within and beneath the skin. Alright? And this requires medical attention. You can't sit down and watch it. Alright? Because there are some cases where, or it depends on what is the mode of transmission. Sometimes it's a puncture wound, sometimes it's even as simple as a mosquito bite. You scratch the air with dirty nails and you gradually introduce more and more germs into that area. And if you do it consistently and your immune system is weak, it cannot stop the germs from spreading. So it spreads and just causes that area of localized redness, swelling, tenderness, and sometimes fever. There was one time I remember that we had to admit somebody to the hospital because of cellulitis. It was bigger than this. However, they had to spend 7 days in the hospital just to get it going. Alright? The other one is, next slide, osteomyelitis. Osteobone. Anytime you hear the word itis, it means inflammation of the premises. So the suffix itis means inflammation. So it's an osteo is bone and myelin is muscle. So it's an infection or inflammation of the bone and the muscle. Now, the major cause of osteomyelitis is where the infection has seeped inside the bone. That is the primary source. The bone itself becomes infected. And we would say osteomyelitis is the worst form of infection as far as I'm concerned. I would say worst is the hardest to treat. It is super hard to treat. When I was at the hospital, there are persons who had this condition and they had osteomyelitis and never got healed. There was a time when we had to amputate somebody's leg because the wound just keep on draining, and it was constantly frustrating. Because the bone the infection enters the bone and it keeps on eating the bone, causing pus to form, and when you cure it, it breaks down. Before I remember this, several times we had to carry a patient in and put in beads, I call them gentamicin beads, and plug them. And we have to keep calling them back every 2 to 3 months to see what is going on. Sometimes it works, sometimes it don't work. And when them don't work with the care in the hospital and sometimes they stay there for weeks with plugging them with antibiotics. It's one of the hardest to get rid of. So that's why when we have rules, we can't play with them. No, this is what we're seeing with osteomyelitis. Osteomyelitis is very, very, very funny. There are cases where people have misdiagnosed osteomyelitis for a broken bone because they're so similar. Because they're going to have swelling to the area, it's going to be tender around the area, right? But there's something that is very particular about osteomyelitis. Once you see swelling of the area, and you touch, especially where the bone is, and it's really tender, it's even more tender than the soft part, and you touch the hard part of the bone where the swelling is, and it's very tender. Because the same thing can happen when you have a broken bone. Where the break is the part that is the most tender. But the difference between the two is that one has fever and one does not have fever. Right? And then there was a case where somebody had brought a child to the ward. And the history, when I read it, there was a history that a child fell on the arm and was swollen, right? And they admitted the person. So I said to myself, so when I reached the bedside, I asked the child this very quick. One question. Had fever? He said, yes, sir. How long you had fever? It's not just one day, but he had fever almost every day. So what I had to do, clean out the area, is where the tenderness was, and I had to go for a large bore needle. And when I introduced the needle, the pus was just running. And so we did an x-ray, and there was a confirmation of osteomyelitis. There are certain keys that we, when we're not looking, we look for, called, these are radiological signs, right, that we cure. And one of them is what we call breakdown bone lesions, right? Where you would not see a smoothness in the bones, you would see areas where you see darkness and you see some spots that look like bone. And you would really look at the bone as being deteriorated. So this is what the radiology would look like for osteomyelitis. So if you notice, this is the radiograph of the forearm of an individual as a child, because the growth plate is not yet fused, meaning that the small bones that are in the hand and wrist areas, they are very small, and you see some gaps, like a little cap between a little cap and a small cap, and you see this long bone, and in between that cap and the long bone is a little dark space. We call that the growth phase or the diaphysis, alright? And those are not yet closed, that means it's a child, right? But if you notice, there's a difference between the two bones, the two long bones, don't it?
Yeah.
What is different to you? Alright, look on the bottom one. What it looks like to you? It is linear, don't it? It is white. It looks healthy, don't it? Look on the top one. The top one looks like the bottom one? No. Right. You see the areas of transparency, don't it? And it is not straight. You see the areas where you look like it breaks. Right. Because the bone, the infection eats away the bone. So the bone cannot stay as one. So it breaks. So this individual, this is the child, is going to have a very difficult period in his life, because this bone may not grow properly and may have a deformity. You understand? And not only that, the child will constantly be in pain, discomfort, and sometimes drained, possibly something up rising. So the quality of life of this child is going to be very poor. Right? So that is why we have to pay attention to the kind of wound. And that is why if you get a laceration, and that is why we had mentioned in the slide, this some of the risks, the depth of other slide, please. All right. Necrotizing fasciitis. Necrotizing fasciitis. What a difficult word, don't it? What two words? I think one word, no. Two big words. All right, let us try and break it down. Necrotizing. When you hear about necrotizing, it's similar to a word we call necromancy, don't it? Which means dead. Right? So we have dead. Sorry, thank you very much. Rotten. Dead and rotten. So we have dead and rotten. And remember what itis means? Inflammation. Right. Fascia. The fascia is a membrane that separates different muscle groups. Because in order for us to bend and straighten, all muscles can't be in one area. They have little membranes in between the different muscle groups so they work independently so that I can twist my arm, turn it around, bend it, straighten it out. And if everything was just matted together, I couldn't be with the stick like a robot. So you need a fascia in between these muscle groups for the muscles to work by themselves without interacting with the other one and causing disruption. So we have, so anybody can, based on what I just explained to you, can anybody tell me what then the necrotizing fasciitis is? We broke it down. Dead, decay, inflammation of the fascia. Right? So when we look at that move now, the fascia, yes, the fascia is affected. The fascia is affected, and because the fascia is affected, because different groups of muscles are attached to it, it not only affects the fascia, but it also affects the muscles as well. It can cause stiffness as well. And then because the muscles are affected, the fascia is affected, what do you think the skin is going to look like? Swollen. It's going to get discolored, sometimes blue, right? And when you touch it, the important thing, the one thing on earth, is that something that distinguishes this from other swellings of long bones or long parts of the body, especially like the legs and the forearms, is that when you touch it, the pain that the person feels is way more than the pressure that they put down. Right? Because the pressure is being built up so much and it's squeezing down on the nerves, and what else is being squeezed down to? The blood supply. So when you squeeze down on the blood supply, that means you're blocking it off. So as a result of that, those blood areas cannot get a chance to get nutrition, and they cannot flood out and wash out the infection and inflammation that is there. So it's dead, decaying matter that is there in the skin. Or no, not in the skin, deep below. So all of these now is as a result, or can be as a result of infection of that's not treated. And cellulitis and the necrotizing fasciitis, mainly, especially necrotizing fasciitis, is the main cause. The main cause is due to an infected needle. And it's normally a person who do drugs. Because they share the needles, they put it down, they use it another day, they don't replace the needles, they drop on the ground, because it's so when you know they're not connected with reality, so you just see the teeth of the stuff and plug it in, germs on it, and it's not on the skin, you know, it goes deep down. Sometimes they want to hit the blood vessel, but sometimes they're so high that they miss the blood vessel and go deep and penetrate and go down to the fascia, introduce the germs down there and cause infection of the cell. These are the persons who tend to get the necrotizing fasciitis. The other one now, sepsis. Sepsis. This is the meat of the matter, right? Now, sepsis a potentially life-threatening entity where when the body meets upon an infection, the response is exaggerated. Whenever we have an infection, right? Some kind of infection can go in your bloodstream, right? But the body is able to detect it. It sends out fighting molecules, right? And we call one of them into one broad body, we call them white blood cells. But there are many types of white blood cells. These are soldiers of the body, right? We have macrophages, lymphocytes, you name them, right? Even for me sometimes I lose one because there are so many, right? But generally, they are what we call white blood cells. These are our defense. These are our soldiers in the body. So the soldiers in the body realizes that there is an invading or an unwanted material in the blood supply. So what happens is that the invading particle, not invading, the fighter cell sees it, detects it, but there are some units, some capture units on its body that it recognizes that this is an invading particle. And once it attaches itself to that invading particle, it doesn't just eat up like that. What it does, it produces some chemicals, we call them cytokines. It's a fancy word that means chemicals that the fighter cells release, and they serve various functions in the body. You can bring up the other slide for me. So here we have a simplified version of sepsis, where we have the bacteria and we have the white blood cells. They attach themselves onto the bacteria and then they release the cytokines. No, the cytokines, no, we're going to talk about the cytokines because this is where it's going to start affecting us and cause us to go into this phenomenon. So, the cytokines, when they are produced, if it is that our body, two things can happen. We can have so much bacteria in our bodies, or our bodies are in such a fashion where it overproduces the cytokines. Now, the cytokines, as I said, they are broken down into different subgroups. You have the innate, you have the adaptive, the innate causes. Once and you have within the innate, you have breaking down. Some fancy terms they call interleukins. They call it, instead of writing interleukin, they write just IL, and then you have interleukin alpha, beta, you have interleukin 1, 12, 6, and each of them have different functions. One of them, we call it an apocrine system. What it does, it releases the same cell that releases these cytokines. It comes back on itself and causes it to multiply. So it can mount a response. Right? Another phase of this now, it can go to neighboring cells and cause other cells that did produce it to transform or to, and when I mean transform, to change its shape and to change its function. So a cell that was just relaxing now because it's like steroids, it becomes stronger and become more robust effect, and sometimes cause it to divide and multiply. So it depends on the kind of cytokines that we produce. Now, this cytokine now, the thing now is that these chemicals can move from that area where the infection is and goes to two areas first, the brain and the liver. The liver is going to convert that into another protein we call C-reactive protein. And also the brain, when it goes to the brain, it's going to cause the brain to start producing heat, and as a result you get fever. The problem with that is that instead of it being regulated, you just have more production of cytokines, more production of cytokines, more production of cytokines, so much cytokines, right? And the thing is now, the cytokines have effects on the cells, and they also have effects on the blood vessels as well. So you look at this diagram here. They have a large vessel. Now, when they go into their organs, they're going to break up into smaller units. They call them arterioles, right? They have artery and they have arterioles because they become very, 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 very fine. And the purpose of these now is to provide nutrients to the organs, don't they? Right? Because you can't just put in a big blood vessel into your brain and expect the brain to get the blood vessel. No, it will just bleed out. So you have to break them up into very, very small units so you can deliver oxygen to the different parts. So guys, anyways, so that is what happens. Now, whenever we have this happening, remember we had mentioned during the inflammatory stage of healing, you have the blood vessel dilating, right? The blood vessel dilates, which is good, but the thing is we have an overproduction of these chemical units in the body. So when they go to those specific organs, it's going to cause these blood vessels to open up more. And what will happen? They're going to have more seepage of fluid from the vessels inside that organ, don't it? So that's one thing. And then instead of it being a small amount, it's going to just continue getting more and more. The other thing too is that the lining of these vessels are so tiny that it stretches it and starts breaking out. So you're going to have a flooding of, it's not in blood, they call it plasma, because blood contains different parts. It has a solid part and a fluid part. And the part that we call plasma or serum moves into the organ. So the organ basically is drowning, don't it? Right. So it's drowning, and because they're not having enough blood vessels, because the blood vessels are broken now, you're not going to have delivery of oxygen and nutrients to these organs. Right? So you have those organs being inflamed. They're going to get swollen because you have a lot of fluid seeping in it. And then now you have a situation now where the blood now is trying to stop the bleeding or stop the seepage. So it's going to start forming small clots. So some parts are going to have clots and going to have some parts leaking. And as a result, what is going to happen to the function of these organs? They're going to start deteriorating. Right? And one of the first places that tends to happen, or the first sign of sepsis, apart from generalized, apart from fever, it starts affecting your lungs. Because you're going to realize that you're unable to do gaseous exchange. Because the blood vessels block up, some of them burst, and some of them leaking fluid into the air. So your respiration is going to be compromised. And what the body does know, in order to compensate or to bridge the gap, what do you think happens? They start breathing faster. They're not getting enough air with normal breathing, so they increase the amount of respiration or breath we call it per minute. Going to the liver now or to the kidney is where you have exchange or movement of waste products. If it is that this is happening where you have, because in order for exchange to happen in the kidney, you have to have a functioning blood supply. And if it is broken, what do you think is going to happen? Do you think you're going to have good exchange? You're going to have the waste products coming out in the kidney? No. It's going to start backing up. And backing up in the kidney. And then now, you're going to realize that some days you cannot filter the kidney. You cannot filter it. And if you're not passing enough fluid through your kidney, what is going to happen to your urine? Going to get less. And when it becomes less, you're going to see the color of urine. The urine is going to become what? Darker in color. And then if you're not losing the fluid, what is going to start happening to you? It starts well. Because there's no way to put all that fluid. Right? And as a result of that, you have increased respiration, kidney not filtering, And then the poor brain now. Poor brain. The same thing happens to the brain. Right? The brain now reaches that point where the amount of fluid that's supposed to reach where it's swelling in and it's not reaching, so it's going to happen. Somebody who's not getting enough blood supply, what do you think is going to come to that person? Before you black out, what happened?
Confused.
Huh?
Disoriented.
Huh? Alright, so just look down. When if something happens to somebody's brain when they're not getting enough blood supply, what do you think is going to happen to that person? Ability to reason. Thank you very much.
Confused.
That is the word.
Disoriented.
That is one of the signs. You look about fast breathing, the kidney not filtering, and the person will start chat all garbage. Gibberish. They're talking to them and they're looking in your face. They're going to answer things that they never asked them or answer things appropriately. Alright? And then no, the heart is going to be affected as well. And because there's a demand more put on the body because the blood, remember we said that the blood vessels been open up. So the pressure is going to what? Drop. Right? So you're not having, because it's just like you have a hose. If you have a hose and you turn on the pipe and you squeeze the end, the water is going to come out what? No, and you squeeze it and it's only a small portion of the end of the hose is going to have. The water is going to come out and a bit more pressure, don't it? It's going to squirt out. But let us say that's end now, you open it out. Why? What is going to happen to the pressure? It's going to drop. And it's the same thing happening because you have generalized inflammation. The blood vessels then open up. So the heart, so the pressure is going to drop. And when the pressure drops, it means that not enough blood reaching the organs, right? So what does the heart have to do to compensate or to bridge the gap? Be faster. Right? So we have the organs being affected, and that's why sepsis is so potentially dangerous because it leads to organ damage and ultimately organ failure, which is the last part, which we call shock. Meaning that shock literally means hypoxic, meaning that zero or very little oxygen is going to go. Alright? Let's just go back to the other slide. So these are different stages of sepsis. The first stage we call it mild sepsis, where we just have fever, you're fast breathing, there is some amount of reduction in the urine. Alright? This is when the body is trying to put up a defense. But it is that depending on the nature of the injury, depending on the nature of the health status of that individual, and that individual cannot mount a proper response, and that, remember, we call it cytokines. This term used to be popular in COVID. We call it a cytokine storm, or hyper-proliferation of cytokines, that we call it. And if this continues, as we said, you're going to have the organs start being affected, and this is where we're going to start seeing the rapid breathing, the high the drop in the blood pressure, and the rapid heart rate, the confusion, and if it progresses now to where we have septic shock, this is where things tend to go belly up, meaning that it really looks bad. That the blood pressure is so low that even when you give the person fluids to bring about the blood pressure, it will not come up. And sometimes even when you fill them what we call colloids, these are agents that kind of thick. So it kind of builds up the thickness of the blood, not even that can work. And unfortunately, there are persons who will die from septic shock. There are statistics is that anywhere between 20 to 50% of persons who have sepsis can go to septic shock and die. Alright? And this is where, as I said, we have organs. The organs are shut off and there's nothing more because the length of time which the organs go without oxygen is far gone. It's just like you're in this room and the whole place is locked off. There's no air. After a while, you don't get oxygen. That's what is happening with these organs. Right? And unfortunately, these are what we have. Right? However, because of potential complications, we don't want to reach it. We don't want to reach it. So just in case we have, or if you know somebody who is going to the home, there's some little tips we can share to reduce the risks of it becoming infected. And this is what we call teaming up with our move on to that side. Alright, this is what I found. Some basic items for wound cleaning. Anybody can identify anything here? Nitrogen dioxide. Thank you very much. Which one? You want it? Jennifer, can we use R? What's that again? Yes. What else we have there? Gauze. Thank you very much. Gauze is there. And something that you can get available. The screen is hiding the bottle that is there. But there's a next bottle there that we all can have. Normal saline. This is salt. Or sterile salt. Right? Is there anything that's not anything that's really anything else you can put here? Or basic food here? What about alcohol? Anything else you can put it on there? Somebody said that in the process. And injured now, what we're going to do first. Alright, sometimes we need to come in the order. Depends on what's happening, because if it is dirty, what we're going to do? We're going to wash it out. What's the best way to wash it out? Run in the water. Just put it on the ground and the water run it out. Because you have to be careful when you're cleaning if it is that you're going to be using an instrument like a gas to clean, because you may do more damage. Alright, let us say that it's a clean wound that you finish washing it off, and it is still bleeding. What do you think we should do? Alright, if it is bleeding, what we want to do? Stop the bleeding. So you want to apply pressure with what? Something clean. Thank you very much. It's good to use something clean. Right? What you're doing, you're assisting the body in the phase that we call homeostasis. Because remember, one of the first things is that the blood vessels will constrict or get smaller to reduce the blood flow or the blood loss. So when you apply the pressure, you're just going to be giving the body more time to send information here to narrow it down and to block it out. Alright? So you apply the pressure, right? Now, you apply the pressure, right? Bleeding has stopped. What do you think we're going to know? Yes, we can do the hydrogen peroxide or
Normal seal.
we can do. Start cleaning up, but we do the cleaning already. And bleeding stop, then we can start with the dressing. The dressing. And it depends on the size. If it's a small dress, if it's a small cut, I mean a band-aid. If it's a bit long, if it's a bit larger, you may have to use some gauze, right? And do some dressing. Now, that being said, once we have done that, it's good and as you said, the wound will tell you what you're going to do. Is going to stay at home or are you going to care to the doctor? No, there's some caveats we can talk about which case you're going to care to the doctor. For those cases that we don't have to care to the doctor, let's just say that we're at home now and we're comfortable with the cut. After we cut on it, after we dress it, we're just going to leave it alone? No. Or we're going to do it? Continue doing dressing, right? It depends. Sometimes you can do dressing before. If it's a big cut, we have to dress the following day. Sometimes dressing do not require everyday dressing. You probably just look at it the other day, but before you dress it, you have to monitor it. Because when you look and see what is happening, you can decide what steps you're going to take. So if it is that the wound is still bleeding, you still need to apply pressure and dress. If it is not bleeding, then we can just do every other day. Make sure the antibiotic cream is there, it's covered until it starts healing. Alright? Alright. Let us go on to the other thing. Now, when you see a doctor, alright. One. When would you feel uncomfortable attending to a wound and you prefer to care to the nurse or the doctor? What would cause you to say, alright, this is legal and legal? What about wound that would cause you the size. Very important. The size, the size will be how deep and how wide it is, or the nature of the wound. Right? So if the wound is wide, it's deep. The edges, if you look, for example, if you drop somebody to fell on the ground, and you look at the wound and you lose some skin, and you realize that it's not going to close up. If you leave it by itself and start closing, you know that is legalness. Right? You have to carry it further, right? Alright. And if it is that if you look, right, and the wound is deep, especially if it's in your hand, or in your foot, or even in a shin bone, and when you look, you say, no man, this doesn't look like flesh, this looks like bone. You have to look at that. There is absolutely no way you can see that on the because we want to prevent that. carry them in the theater and wash them and keep them on water for a couple of days with antibiotics and things at least a week, and then we decide if we want to keep them on our system. Alright? So we said that there is the size or the nature of the wound. When else do you?
If you cannot control the bleeding.
If you cannot control bleeding. Very important. Because there are some wounds that no matter how much compression that you apply, you will never stop because it's very difficult to stop. Sometimes you may need to inject some vasoconstrictors, we call them adrenaline, right? Or to apply them, you may need to apply them irregularly to the wound. Most wounds do not have this to help to constrict it. Sometimes it's a large blood vessel that is ruptured and you need to pull it so to tie them off or lightning them. Alright? So that's one. So we have the nature of the wound, the bleeding, if it's not controlled, anything else.
Or if the person, what about if the wound causes a person to lose some consciousness?
That too. So the surrounding conditions of that individual. So if it is that after you do the blood, you have some persons who will stay at sight of blood, even if it's not their blood. I remember I was attending to the child of the father, and I was going to draw some blood from the child. The dad said to me, Doc, I do not like to see blood. I said, well, I see blood apostle. I've never seen that before. So I was attending to the child, my back was turned to the father. And drew the blood. I heard crap. So then I could not drop coconuts on the road. Man fell down. Person said that he carried the So, yes, I've never seen that before. Right? So, it was traumatic. Fell in shock. As the blood supply just dropped and it was really explosive. So, that being said, now, if it is that if the person bleeds out or bleeds, and if you know that it's not the cause, it's the side of the cause the person feels. The person starts feeling faint, otherwise yesterday, or hurt in the hospital. Just check the blood pressure and etc. to find out what's going on. Alright? Other reasons? Sometimes. Let us say that you didn't know. Let us say that you're talking to a good friend, a colleague. It's why so this is the other day and start every now and then you see everybody cold and they're inside the keyboard. Sometimes I have pain all over and I sweat and fever and sometimes I feel like vomit. Right? And say, that person may say, why you fool me at home? Right? But let us say that you look at his foot. Right? And you see that the person's foot swell up. And you say, your foot swell up. And you say, you know someone who complicates over there? And you expose the foot. And you see that there's a wound. And the wound looks infected. Would you say, it's probably slow? No. Alright. What do you think is happening? Infection going in there, and the blood going in the circulatory system, meaning the person developing sepsis. Right? So you cannot play around with that anymore. So if it is that the person had a wound for a while, wasn't attending to it, and worse if the person has what? Diabetes.
No problem.
No period. Let's say, look here. Pop this up, I want to ask you. Right? So these are some of the reasons why we don't bother with home remedies. We skip that and go straight to the hospital and the healthcare facility. Oh yes, right. That's it. So with the nature of the wound not seen together. If not, this is another one. If not all wound can
know.
Gee whiz.
Yes.
When the police, as soon as I think this, come on, I don't know what the bikers they don't know where they come from Sepsis.
Oh yes. Oh yes.
There was one time when one section of the cubicle has 4 beds. 3 of them are brothers and one goes. 3 brothers and one goes. No joke.
For them hospital.
So one of the brothers said, and as soon as I fix it, come on. Alright. So this guy, you know, he had to come in, well, all of them had to come in. But one of them had what we call a bone fracture. Meaning that there was a communication with bone that was fractured. The bone was opening out, and you could see inside the bone was broken. So he know, when he fell on the ground, contaminants fell in the bone and fell in the muscle. So those kinds of injuries, once you realize that there's dirt there, don't try to hold some of it as much as possible, and then you carry it to the hospital as soon as possible, because that requires emergent handling. There was a case where, when I was overseas, there was another bike person who fell off in the bush, and he was not treated properly, put him in cast, and something. I was there complaining about the burst in cast, and would swell up there and refund. He had to be carried to another state for them to save the foot. And the doctor saw me, not the doctor, the patient saw me, he was saying, that guy, he never did me properly, basically left dirt in my foot. Grass was in there, man. No, I didn't say anything. But I know that if they don't clean that, those are what we call foreign bodies. Foreign bodies is a host of germs. Germs, so I don't know if it's full of problems is that. It's a good thing it was caught before it developed into sepsis. So these are some reasons. And the other one too, which I mentioned, whenever there are signs and symptoms of infection, and whenever, and it depends on the cause. If the cause is of a rusting, or a dirty object, or if it's a bite, whether animal or human bite, these need prompt medical attention. And with that being said, I end this presentation. Thank you very much.
If you're addressing the wound and it's not, you don't see where there is any sign of healing, would it not be a cause for you to take it? So
yes. If you think that the healing is not happening, yes, because it's not happening. Probably the person with the antibiotics and stuff, and special this is good care.
So back in the days when I got a cut, my mom would throw salt in it. And we didn't have to go to see a doctor.
Yes, as you said, it depends on the nature of the wound. It depends on the nature of the wound. And that's what I'm saying. Not all wounds need to be attended by a healthcare professional. But it's just to be aware. As we should be starting with the wound. And that wound will get it better. I don't think we need more salt. That is if you want to harm me. That's how I know.
Yeah. I know that we are taught that, greatest sign of sepsis is usually fever. But what about if the patient doesn't have that fever and is cold or clammy or shivering? You know, how do we know?
You are very well informed. That is very true. That is very true. This is something I should have mentioned as well. There are categories of individuals who will not mount a response, call it an inflammatory response, as genetic individuals. These individuals are normally immunocompromised. Their immune system is weak, so they can't mount a proper defense. And so instead of producing high temperature, they produce a low temperature or low temperature. The temperature remains untreated. You have to pay attention to those. So if it is that a person starts complaining of the cold, and even if they're not complaining of the cold, then test the temperature. And the temperature drops below 96, 97. You have to assume that something is wrong. But the thing is though, it will be good for us to look on the other side. Fast breathing, personal, they look dry in the face, they stick out the tongue is dry, the urine, the normal times that we normally go to the bathroom, use, etc. But that is a very good one. And normally is a result of persons who are immunocompromised. Any comment, any question? Yes, sir. You mean if the infection can affect pressure? Well, there are cases, there are two possibilities. There are three possibilities. It depends on how far in the infection. If the infection just starts, it may not affect the blood pressure. If it is that the infection has advanced, it can bring the blood pressure up. That means it's bad but not too bad. But if you are somebody who suffers from high blood pressure, and the infection is there, and you realize that even when you don't take blood pressure, the blood pressure drops. You don't wait anymore. That means something is happening in your body. Right? That means infection is spreading. The problem is spreading. Right? And then another thing, persons who have diabetes. In the body, it's something that tends to happen. Whenever there's an infection, the blood sugar always goes up. And this is as a result of certain cascades we call them, where your adrenals become hot. And your adrenals will start pumping up cortisol. The cortisol, which is a hormone that activates your, what we call it, the sympathetic system, meaning that it releases for fight or flight. It's going to increase all those other hormones that releases sugar into the bloodstream. So even if your blood sugar was controlled and was always controlled, but you realize that it is no uncontrolled, it's gone up, that means infection has overtaken your body. And we need treatment, especially if the infection is on board and there's no antibiotic taken.
I don't know how you term it, no. But when we were growing up, we hear say people have bad skin. I don't know whether that fall in where you term it. Bad skin, because sometimes you grow up and you see people with cut and it's because of they have bad skin. I remember like some hot so yeah. I'm not sure.
Bad skin is a bit unclear. Because I'm not certain. Well, I'm not certain what both have to do. I realize that but I'm not certain what they meant by bad skin. It is a case where the wound was taking too long to heal. Oh, okay.
Besides,
was a fraud. So that means those people back then were showing signs of something, and because they said it's bad skin, they don't have to check out. And it's true because even with my grandfather, he had a woman that never healed. When I was a child and I was visiting, you know, people would say that it's mobile over there. He sat there with the woman until he had to chop out. Never knew that. And to be honest with you, that woman was even bigger because it showed that his really cancer he had. But we never knew. And that's why he had it there for years. So probably those people with bad skin had something going on in them. They never got checked out and they developed this. Anything about this? All right. Again, thank you very much for having me. You all were great.
Thank you so much, Dr. Johnson. I have a question. What about those persons who there's no cut, but something is happening on the lip skin? What about that? There's no cut, but something is happening there. And I see a hand.
Very good question. Very good question. There are some complications like sepsis in the necrotizing cells where you may not see a cut, but something is developing. There are percentage of those kinds of developments where we call it etiology or the origin is not known. We do not know. So let's accept it for what it is. However, there are cases where you may have an infection somewhere else in the body, deep within the body, and manifests itself, especially sepsis. People, especially advanced ages, very elderly, or those who are immunocompromised. If you have a urinary tract infection, or if you have a pneumonia, it can lead to sepsis, even without a cause. Right? And that is why pneumonia is one of the leading cause of death in elderly folks and elderly folks with complications. And even with the cellulitis, and even the necrotizing fasciitis, in quite a number of these cases, even those that were presented at the world, we did not see a focus or a point of origin on the skin that would say that. So yes, we do have cases like this.
Thank you. Sister Olivia.
We're just talking, and we wanted to know, like, what are some of these things that can help the healing process?
Very good, very good. Alright, one. Alright, so we did all of the preparations. Alright? Now, we have to be physically fit. Our nutrition has to be adequate. So, we need to have a lot of vitamin C. Right? We need to have the array of B complexes. Because B complexes improve your blood supply and your helps with removing of inflammation. Your vitamin D. Vitamin D is not only for hormones, and it improves and modifies your immune system. So if it is that it's overactive, it brings it down to the base level it's supposed to be. If it's too low, it brings it up where it's supposed to be. You need adequate sunlight. Sunlight is the best form of vitamin D. Yep. You need to have enough good quality oils, especially women. You need to go out and enjoy sunbath. we are vitamin D deficient, irrespective of us living in a tropical climate country, because we wear long frocks, long shirts, long sleeves. We barely get in the sun, and if you do get sun, it's really our face that gets the sun. And sometimes we have these hats that cover the sun from reaching our skin. We as black people need to spend at least 4 times the amount of time in the sun as a white person. Because a white person does not have the blocking agent, the melanin of the skin. So we are so designed for the tropics because we do not need so much, but we have it there to reduce the effects of certain parts of the ultraviolet rays. Because you have ultraviolet A, B, and C. You do not need A, you need B and C. So the melatonin blocks off the A because we are heavy because of the kind of rays that enter. White people tend to be higher up in the altitudes, so the rays that reach them is kind of different from us. So we need vitamin D, or we need the sun, and when we have proper oils in our sun, in our system, when we enter the sunlight, the rays hit the skin, and it goes beyond the skin, goes a little deeper because B penetrates the skin better than C. And then it hits the oils that's in the small capillaries or blood supply beneath the skin. And when the sun hits the oil, it converts it to vitamin D. And then through processes, it converts it to vitamin D3, which is the active form. And then the vitamin D3 now moves and helps supply and make different hormones in the body. One of the things vitamin D3 does is that it helps to regulate our immune system. So as I said before, if it is that it is low, it brings it up. So proper nutrition is very important. We need proper sleep as well, alright? Because sleeping reduces inflammation and it resets our immune system, right? So if you realize that persons who are ill, even before we reach humans, you realize that when we have a dog that is injured, it's not good. The dogs are sleeping more than normal, don't they? Right. Even animals follow the laws of nature. That's what you are talking about. So the more sleep you get, you're pure, the body is healing itself. Especially with night sleep. And you need to go in the last 2 phases of sleep. Stage 4, and the REM, the rapid eye movement of sleep. These 2 last phases of sleep phase really sets the body to heal. So it needs your lifestyle is important. You need your rest, you need sleep, you need your nutrition, you need physical exercise. 1, to retone your musculature, and musculature will help to retone your hormones. Your hormones, especially serotonin and endorphins, these are natural immune boosters. Right? You realize that happier people tend to be stronger people. There was a symposium in the United States last year, and it was the Cancer Society. And these are top-notch doctors from all over the world. And instead of them talking about cancer, and instead of them talking about chemical reagents to fight cancer, you know what we're talking about? just ask you to tune in on the last Wednesday episode. Missionary Bachman will give you more detailed results. Alright?
One last. Sister Kathy's going to come with a vote of thanks. But there's one, I think she's going to bring one.
I had a fall the other day and I hit my knee very hard. And it's not swollen and it's not painful, but each time I rub it, I feel something across here. So I was wondering if there's something that she takes in. So,
How should I start now? Alright, there are a number of things I would have to clarify. One, how long were you for? 3 days ago. Alright. When you fall, right? When you fell, sorry, was there any immediate swelling to that area? Just referral. Alright. We ask this question, especially when I was in orthopedics. If you fall and injure a part of your body, and especially where you feel the bone, and if there's immediate swelling, you need to go to the doctor because it's very possible that even if there's not a break there, there's a tear in the sheath that covers the bone. Right? We call it, and if you do an x-ray, you will not see a crack. But there's something we call a peristal elevation. That means there's a slight tear in the outer layer, we call it cortex of the bone, and blood seeps into it, and it seeps between the bone and the sheath. And it literally lifts up like a flag. We call it flag sealed sign. Right? So they never had that. So I don't think it's a broken, because you wouldn't be standing right here. Right? The other thing too, it seems as though it's sort of a soft tissue injury, meaning that the ligaments, and the bones and the tendons that got bruised. So it's still going to be sore. So when you fell, it transmitted the energy to the different areas around you. So when you press on one side, the inflammation is still there. So it's like a wave, like a Mexican wave. It's stimulated. So that area where you have the bruising, if you just one area that you stimulate, it will be transmitted around that line of the soft tissue that was injured and inflamed. But it will go down. They tend to last about 2 or 3 minutes and go down. Even without pain medication. Alright?
Alright, thank you so much. No, thank you so much. Alright, so Sister Kathy is going to come with a vote of thanks, and then we're going to do our